most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today the question is, can saline irrigation help nasal allergies? We're going to have a pharmacist's opinion on this, on sinus nasal flush.
Oh,
So what do you know about this, Brad? Well, we're not going to talk about that. First,
okay.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. What are you doing? You can also go to bobandbrad.com. Go to the giveaway section because we're always giving something away. This week we're giving away books. From Lotus Publishing.
Yes, and they're all of them related to health, right?
Right.
Health, fitness, and being pain-free, which matches our mission.
So if you win, you can go to Lotus Publishing and pick out which books you want.
Yep.
So you can also find the contest on Facebook. It'll be pinned to the top of the page. Go to Twitter, Instagram, or TikTok.
That's right.
If you want a 60-second version of our program, you don't want to hear us ramble. And what do we have, Brad?
Well, we have the podcast now, so you can listen to us even in your vehicle now. So that's exciting.
Yeah, so we probably see a lot of people vomiting in their vehicles. So,
why, Bob?
Why? All right. So, Brad, let's get back to this.
Yeah.
What do you know about saline irrigation or nasal lavage and all that?
To be honest with you, Bob, I don't know what the heck you're talking about. I have never heard of this before, so I'm a little bit.
All right, we gotta get rid of this. All right, here we go.
Hey, Bob.
Thanks for coming by.
You betcha.
So we got Chris the Pharmacist, and a real expert on this, has dealt with this for years, I'm sure, with
talking about it all the time. Absolutely. Yeah.
So
staple.
So what does nasal lavage help with? I mean, what does saline solution irrigation help
Yeah, I mean, a saline irrigation is basically when people either have sinusitis, which is a sinus infection, or allergies, although it seems to be a little bit more effective for sinusitis. It's just basically salt water that's poured into the nose and then flushed out. So what that's going to do is just kind of clear all the junk out of there. So if it's, in case we're talking, since we're heading into allergy season, it's going to help to get some of the allergens that are irritating your sinuses out. Or if it's infection, if there's bacteria harboring in there, it's going to help to kind of clear that out to allow your body's natural immune system work more efficiently.
You talked about proteins when we were talking off camera.
Well, yeah, I mean, an allergen is just kind of so if it's cat dander or, dog dander or, let's say, I mean, it can be mold spores or it can be, just ragweed or whatever. I mean, there's a gazillion different allergies that somebody can be irritated with, but it's essentially a protein sequence in those allergens that create your body's immune response, and then you get phlegm and all the good stuff that causes all those little chemotoxic factors that are going to make you feel miserable: watery eyes, runny nose, sneezing, the whole 9 yards.
And you were alluding to the fact before that it's best to get on top of this. I mean, once it's kind of embedded, that it's over, right?
Yeah, I mean, you want to be proactive. Now, if you know you're a seasonal allergy person, you want to be treating those preemptively. So a lot of times I'll tell people to start ramping up for their allergy season in mid to late February, because it's March when, the thaw, like with us in Minnesota and Wisconsin, we're heading into our normal thaw and heading, in our normal spring weather. And so things are starting to pollinate, and allergies are actually really bad early up here this year. So it's actually pretty high allergen content. So yeah, trying to do a nasal saline, lavage, I think is very appropriate at this point, coupling with antihistamines and nasal sprays that we would recommend as well.
As far as antihistamines, can you overdo those?
Well, you want to use them as directed. I mean, really, everything that used to be a prescription when I came out in my career is now available full strength over the counter.
Sure.
So, it's either going to be loratadine, which is Claritin, it's going to be cetirizine, which is Zyrtec, and it's going to be fexofenadine, which is Allegra, and then Xyzal, which is fancy cetirizine. So, it's which is levocetirizine. So, it's just fancy cetirizine.
So you just follow it as directed,
yeah, one a day, all of them. That's easy. So it's just one a day. I would tell you that with Xyzal and Zyrtec, small chance of drowsiness, even though they're classified non-sedating. Take them at bedtime for most people.
Sure. Well, I've got an electronic unit here.
All right, and, this is the fun one.
Well,
how do you feel about waterboarding?
Yeah, this is this can go really bad with me sometimes because I think I have a deviated septum.
That could be, and
I didn't know it, but I do this. And I can't breathe very well into this one. And that one I can breathe well into.
That sounds we need like an ENT specialist here at this point.
Right. But what I started doing was wearing the nasal strips at night.
Sure. Does that help?
And it absolutely helped. I was because I was taping my mouth shut, trying to breathe through my nose, and I'd wake up having trouble getting enough air.
Okay. Yeah.
And so now it actually
Yeah,
handles that
just
problem.
enough of a bridge, and they also
Right.
have coils too that you can put on the inside. Some people don't like that adhesive, but
Oh, yeah.
they're like a little spring that they actually insert.
Oh,
into
you're
the
kidding?
No, no.
Is that at your pharmacy?
I've seen them at my pharmacy. I've seen them online. I've had patients bring
Oh.
them in, so they
Oh,
say, "Hey,
thanks,
my
'cause
doctor
I
gave me that."
actually had the tape on last night. My nose
Yeah.
started to bleed
Yeah,
because it's
the
night
adhes-
after night after night.
Well, sure, the adhesive in the same spot because you want to put it. Getting it positioned properly is actually one of
Right.
the best things that you can do. If you can,
Yes.
not that we're getting a little sidetracked, but
No,
it's,
no, that's fantastic. I'm glad you're helping me here. So now this thing all snaps into place. Now the biggest thing is here, you got to make sure you add the water before you put the salt pot in, or you're in trouble.
Yep, you want to make sure that you get a thorough mixture. You
You
don't
want to talk about the water?
Yeah, so basically the water that you can use in these, ideally distilled, or if you're going to use water from your home, filtered is acceptable, but if it's tap water, you must boil it. And there's some debate as though it should be boiled for 1 minute versus 3 to 5 minutes. 1 minute is necessary. It's going to kill all the germs, but then if you go 3 to 5 minutes, that's certainly fine. If it's worth doing, it's worth overdoing. But at some point, make sure it cools down to tepid or room temperature. You don't want really cold water going into your sinus passages either. I mean, even 70
Yeah,
degrees
heat
is...
this up a little bit.
So yeah, it's just be a little bit more comfortable, but you don't want something that's going to scald you because that can actually create injury. And so you want to make sure that whether you use a neti pot, and we'll talk. This is the fancy
Right.
electronic version, but
No, why don't you talk about that right now? Neti pot versus
yeah. So there's
bottle
neti
or-
pot and squeeze bottles are the other types of ways that you can do a nasal lavage.
Probably the
And
easiest way.
yeah, and so that's usually that's what I typically recommend. The squeeze bottles you have to be careful with because if it's too aggressive, you can actually cause harm and injury. There's people have read about the brain-eating amoeba, Naegleria fowlers.
Naegleria fowleria.
Fowleria, yeah, and so I just looked at that a little while ago. It's a pseudo amoeba, and
You really
only-
don't want to get this.
yeah, you don't, but it-
causes a brain
there's-
infection.
brain infection. But there's
Yeah.
only 10 of them in the United States from 2010 to 2000.
10 cases.
Yeah, so it's not
But
common,
you don't
but
wanna
you don't
chance
want
it.
it. It is
Right.
serious. It's nothing to really joke about because it could kill you. But
Yeah, and
I mean, you're
that's
talking
why-
about 10 people out of 350 million.
Yeah, that's why you don't want to use tap water, though. And,
Yep.
and now, good question about though is, let's say you boil the tap water, and then you put it in your refrigerator or whatever to save it. Can you do that, or I don't know.
Because if you have a
Once it's
clean
boiled.
bottle and it's boiled, it's fine as long as the container you place it in is clean. So you wouldn't want to be reusing maybe your exit
Right.
water. So
right, exactly. So, all right, so this has these.
I can't
little-
wait to see this.
Well, I can't either because I know it's going to go bad. Because and by the way, this has it so that the suction is going in this way
Yep.
and out this way.
Yep. and Just
You
make
can-
sure you clean it between uses. That's
Yeah.
a big thing too, because you can actually introduce infection. So either you use like the bulb syringes, the squeeze bottles, your neti pots. Make sure you clean it
Yeah,
between
they
each
have
use.
little, like little sponges that you can on a stick. That
Yep, you can kinda-
yeah, that's what I was
Yep.
using of it. So,
Q-tip will work too.
so I'll put these come with pre-mixed salt pads, and I can put this right on here, foil side down.
It's like a Q-reg.
Yeah, there we go. All right. So what I've discovered, and you probably know this already. One, I was thinking the nasal go up this way, so I should be up like this.
Yeah. Well, nope.
Uh,
Yeah. You actually hold it
No,
level
you
because
hold
your
it
sinus
level.
passages. I mean, you have some above your eyes and they're here.
Yeah.
So-
and that's what I found out.
Yep.
And the other thing, because this side is blocked somewhat, I pushed this side over a little bit. That's what's made a difference for me. We'll see.
All right. We're gonna,
We'll see how
do you
this
want me to
goes.
hold this?
No, I've already made a mess.
All right.
So.
All right. Here we go.
Well, yeah, maybe I could go from the side.
All right.
So you
So
can see that. Oh. All right.
breathe through your mouth.
Yeah. All right.
I know CPR if we have a problem. There we go. This is exciting. This is live filming at its best. Does it really?
Yeah.
Oh my God, Bob.
Well, I don't need to go all the way down. I could just show that you can see the upper level going down.
No, you're just like the commercial. You're smiling, you're happy, and now you're going to be able to breathe so
Yeah.
well when you're done.
So I'm going to stop right here.
Yeah, there's a little residual. Your sinuses can only hold so much,
Yeah.
folks. So
That's
ideally, I recommend that people either do this in their bathrooms or actually even in the shower, just simply because you can kind of clear things out. It's a little easier.
So if you want to be grossed out, you can look down below what the residual was in there. I don't know if you want to.
You're actually pretty clean. I wouldn't
not
be,
too bad.
I wouldn't be drinking that, but
Yeah.
but it definitely it does work, and
Yeah, it
actually
does
it's something
work.
that'll definitely help people to feel a little bit more comfortable.
It feels good when you do it, and that was about as good as it goes for me.
Yeah.
Even though I have a big nose, I have little passages apparently. So
Yeah, you're still a little full.
Yeah.
You
so I'm a
wanna-
little full.
Bob's going to need a little me time.
Yeah. All right. Thanks, Chris, for coming and explaining all of this. And check it out. It's something you can certainly try.
All right. Thanks, guys.
Thanks.